Oh, the weather outside is frightful, but the fire is so delightful. And since we've no place to go, let it snow, let it snow, let it snow.
Most common form of cancer in women and the second leading cause of cancer-related death. It occurs in the milk ducts of the breast. Breast cancer emerges when the cells of the breast begin to grow out of control. These cells form a tumor that can be seen in an X-ray. Merry Christmas!
Hi, Merry Christmas! Welcome to our Christmas party.
Come on
Welcome. Come in. Make yourself at home.
Are you guys ready for your interview?
Yeah, I'm so excited.
Of course. So what are the symptoms of breast cancer?
Some symptoms of breast cancer are skin changes such as swelling, redness, or other visible differences, or increase in size or change in the shape of a breast.
Some other symptoms of breast cancer include general pain in the breast or changes in appearance of one or both nipples.
So how many people in the United States are affected by this disease?
About 1 in 8 women in the United States will develop invasive breast cancer over the course of her lifetime.
Also, a 5-year survival rate for people with breast cancer is 90%, and the 10-year survival rate with people with breast cancer is 83%.
Cellular communication occurs in a series of steps, starting with the reception of a signal on a protein, a transduction pathway, and a cellular response.
Here, a tyrosine kinase protein receptor found in the plasma membrane accepts a ligand, which initiates a signal transduction pathway that sends signals to the nucleus, causing cells to rapidly grow. Tumors grow at such an alarming rate due to unregulated cell division. The signals being sent to surrounding cells is called angiogenesis, which encourages new blood vessels to add to the tumor. Here, a tumor in the breast is forming as normal cells turn into cancer cells via cell communication. So we've seen how prevalent breast cancer is in women. What are some treatments?
Some treatment options include surgery, radiation therapy, and systemic treatments including chemotherapy, hormone therapy, and targeted therapy.
Chemotherapy uses medicine to weaken and destroy cancer cells in the body. Hormone therapy lowers the amount of hormone estrogen in the body and blocks the action of estrogen on breast cancer cells. Targeted therapy takes advantage of the difference between normal cells and cancer cells.
How does this differ from healthy cell communication?
Healthy cells communicate and divide to perform healthy bodily functions.
However, cancer cells overtake signaling pathways, which contributes to metastasis.
Are there any drugs that interrupt cancerous cell communication?
An example of a drug that women can take to help cancerous cell communication is called Avastin. This drug helps prevent specific ligands or signal molecules from binding to the protein receptor. This helps the cells avoid the communication signal, which contributes to metastasis. This is the uncontrolled spreading of cancer to different parts of the body.
So why are you guys so passionate about breast cancer?
During the holidays, we can't take our health for granted. Sarah and I want to create awareness for the struggles that people go through with breast cancer. Fortunately, scientists are working every day to discover a cure.
How have you personally been affected by breast cancer?
Well, my mom was affected by breast cancer. She was diagnosed when she was about 51 years old. She had had a mammogram and something suspicious showed up, so she had a biopsy and she was treated for breast cancer. She had chemotherapy, radiation, and surgery, and she survived, obviously. She's still living today. Another way that my mother was affected by breast cancer was that she, as a result of her treatment, she had had some lymph nodes removed in her armpit, and she developed something called lymphedema, which is one of the side effects for that kind of treatment. And so her lymph system doesn't work necessarily as well because of this, and her arm swells up and she has to wrap it with an ACE bandage to prevent the swelling, and her lymph system doesn't work quite as well because of that. And if she gets a bee sting or a bug bite or something in her arm, without that lymph system working, she can develop an infection, and that could be dangerous as well. So it still affects her to some degree today.